All right. Hi, Dr. Green. I'm Josh. It's
Hi.
nice to meet you.
It's nice to meet you.
Finally meet you in person. I know we had our other rep before me, our sales rep, but I'm Josh, and it's wonderful to meet you and to meet with you today.
Thanks.
Yeah. So, first of all, just tell me a little bit about you and about your company, and what kind of things you're doing. I'm just curious, how many patients do you have on average that come in?
About 30 patients a day.
About 30 a day. Whoa, that's crazy. So like every 10 minutes you're going through a patient, is that right?
Yeah.
Crazy. Okay. How many of those patients deal with allergies and use allergy medications that you prescribe?
About like a quarter of them do.
Okay. Sorry, it's recording on my thing here, so we've got to be kind of loud. Okay, you said about a quarter of them?
Yeah.
So that's like 50 patients a day, is that right?
Mm-hmm.
So about 250 patients deal with allergies that come in within any given week.
Mm-hmm.
Is that about right? Wow.
Yeah.
Okay, that's quite a bit. I didn't realize it was that much. Okay. And just curious, what are you using right now for allergy pills?
Claritil.
Oh yeah, Clarital.
Yeah.
Yeah. Okay. I know a bunch about them. And then you're using Zermatt about 1 out of 3 times. Is that right?
Mm-hmm.
Okay, so it's still new to you guys. Gotcha. And with Claritel, have you seen any problems? I mean, I know that you're not supposed to prescribe it to pregnant women. Is that correct?
Yeah.
Okay, gotcha. And it looks like it charges the insurance companies like $217, right?
Mm-hmm.
So that's a little pricey. And we'll talk a little bit later about ours. Ours is a little bit less than that. And have you seen any problems with patients that have maybe low credit scores or just bad history getting denied with their insurance claims and being able to pay their allergy pills?
Yeah.
Okay. So what, if you, that is quite a problem, right? Seeing that they can't pay their allergy pills, it ends up being really expensive, correct?
Yeah.
Yeah. So what if you had a medicine that was more often approved by the insurance companies? Would that be something that would benefit you guys, knowing that your patients won't have to pay more money out of pocket?
I think so, yeah.
Okay. And it does have a small copay, but that ends up decreasing the chances of getting denied. So, huge advantage there. And, yeah, and what would it mean to you if you knew you had a safe allergy pill that you could comfortably prescribe to nurses, to women that are pregnant? Would that make you be a more credible doctor if you had something that you knew you could prescribe to them?
Mm-hmm.
For sure, right? Okay, so here's our pill. You can hold it a little bit, touch it, feel what it feels like. It's almost like Claritin, right? You just take once every 24 hours. And it can, like I mentioned, it's only $200 for the insurance companies to cover. So quite a bit less than $217 if you're doing 50 patients a day, right?
Mm-hmm.
That's quite a bit of money there. And then they just have to pay between $10 to $20 once a month, which on their end isn't that bad and increases their chances of being able to get it all the way covered past that, right? Which is what we want for the patients of the medical industry. And then something amazing that we have that's unique is these Zermatt pills will reduce your allergy symptoms by 73% on average,
Oh, wow.
which is super high, right? With Claritol, we're looking about just under 60%. So it's really a little bit more of a reliable pill there. And it's generally known to be trusted and a well-known brand that we've got here. And just a quick story. Me personally, I have terrible allergies, specifically with horses and with being outdoors, all the pollen and cotton in the air. So I've been able to use Zermatt, and I rely on this. I know it's something I can trust, and it doesn't give me any bad side effects. But yeah, it's definitely something that could help you guys out cost-wise and something a little more trustable for your patients. Am I right?
Yeah.
Awesome. So do you have any questions for me about what we do and the product or anything like that?
I'm just worried about like side effects and like
Okay, gotcha. So we do have there's only one side effect, which isn't that much, right? Compared to all the medicines out there that have so many side effects. The one side effect is drowsiness, right? So when you take NyQuil, you get, that's a common side effect of NyQuil. Almost always makes you drowsy. But with these pills, with our Zermatt allergy pills, it's only 11%. That only like about 1 out of 10 people get drowsiness, and that's literally the only side effect that comes from these. So
Nice.
Nothing dangerous or anything like that. So yeah. So can we agree that this would be a useful, trustworthy allergy medicine for your patients?
Yeah, I think so.
Awesome. And it would save them the risk of being denied by their insurance. That risk would go down quite a bit. Awesome. Okay. So just quick question for you. I know you work with patients only 18 years and older, right? Okay. So what type of patients do you think would benefit most from this type of allergy medicine?
I think those who are more active in like outdoors and that kind of stuff.
Yeah, just since it's so strong. Is that why you're... Okay, gotcha. Well, perfect. And it looks like we are in Utah, so most of the people you work with are outdoors type people, right?
Yeah.
So I think we've got something here that's perfect for you and your patients. So can I ask you a question?
Sure.
Will you trial these allergy pills on your next few patients? I've got 10 boxes for you. Would you mind doing that on your next 10 patients to see how everything goes?
Yeah, I can.
All right, great. Okay, will you just sign here?
Sure.
And then I'll give you these. I'll leave these with you.
Awesome, thank you.
And then we'll get some over to the pharmacy as well as soon as possible, so you can keep prescribing those. But yeah, I'd love to check in with you next month and see how everything's going with these. Does that work?
Yeah, sounds good.
Okay. All right. It was nice meeting with you, Dr. Green.
Nice to meet you too.
Okay, thank you.
Yep.
Cool.